So vitamins are very important for you as a surgery patient, that you have a good regimen of taking vitamins, because you don't want to become deficient after these surgeries are completed. It's very important. So why don't you guys all say that with me? When you all need to do what? Oh wow, that's pretty sad. I work with junior hires sometimes, so that was they're a little wild, but let's try again. We all need to do what? There you go. Told you we're gonna have fun. What happens with the bypass, which you probably know, is you bypass this primary area in your intestines where vitamins and minerals are absorbed. So if you're a bypass patient, they use the term you're malabsorptive. Basically, your body has trouble absorbing vitamins and minerals because you've bypassed this primary place where they're absorbed. A sleep patient has this skinny shape of like a banana in your stomach now, because they remove part of your stomach, and now you have this banana-shaped stomach, which restricts the amount of food you can eat, because you've got this skinny little stomach. You can't fill it full of food. So now you have what's called a restrictive surgery, and you're restricting the amount of food. Now this isn't an issue for you. You still can absorb vitamins and minerals, but you're limiting how much food you can intake. So as a result, you're not getting that many vitamins and minerals either. So there's a great chance that you might be deficient, the same as a bypass patient. Iron deficiency. We're going to start with that tonight, your iron deficiency. If you're a bypass patient, the reason why you might be deficient, as I mentioned, is you're bypassing that primary place where iron is absorbed. Another issue that surgery patients have, both bypass and sleeve, is your body is now developing a limited amount of gastric acid. Okay? Your stomach's the size of your thumb, your little pouch, or a skinny little sleeve. You're not developing as much gastric acid as you did in your larger stomach. So as a result, you have a smaller amount of gastric acid, which is more difficult to break down the iron so your body can absorb it, okay? And then also maybe after surgery, a lot of people don't want to eat meat and have trouble getting meat down. So you're not getting any iron from the meat that you eat, okay? So iron deficiencies are very common for bariatric surgery patients. 25 to 52% of bypass patients report that they've had a deficiency. Okay? And it's often within 6 to 9 months after surgery. Okay, so that's something that's common. Premenopausal females have 2 times the risk of having an iron deficiency, and an iron deficiency gets kind of worse over time. It can take over 3 to 4 years before you're deficient with iron. Okay? So you want to be sure you do what?
Take your vitamins.
Very good. Things to look for. Some effects that may happen with an iron deficiency. You may have a smooth tongue. That's very common with an iron deficiency. You may have brittle nails is also common. And then a third thing is pica. Anybody ever heard of pica? Pica? Pica is a disease that's as a result of an iron deficiency, but one of the symptoms of that is having this desire to have a gritty texture in your mouth. Okay? Chewing ice is one of the biggest ones. Now don't freak out and go, oh, I chew ice, I must have an iron deficiency. Maybe not. But other things, in extreme cases, people want to have dirt in their mouth or detergent, things of a gritty texture that they just have this need for it if they're deficient in iron. Okay, so if you're eating dirt and washing it out with detergent, you may want to get your blood work done to see if you're okay with iron, okay? So you can also have anemia, fatigue, weakness, pale skin as a result of an iron deficiency, a low immunity, you might be getting sick. And as a result, if you become deficient in iron, you may have to get infusions to get your iron levels up, and it's a mess. You don't want to get to a point where you get things so low that they have to take drastic measures to bring your deficiency to get you to not be deficient. So you have to be sure you have a good vitamin regimen so you're getting your vitamins, okay? I like to view it like this. I don't know if I came up with an example myself or what, because I'm pretty smart. Thank you, somebody laughed. No, I like to view our bodies kind of like a printer. Like you have a printer at your office or home when you print something up, and in that printer are a bunch of cartridges, right? You know, if you have a big one at work, you might have like cayenne blue, magenta, yellow, all these different colors and black, in a bunch of cartridges. And our body's kind of like that, where we store up vitamins in us in these cartridges, and then we begin to deplete them and use them up as we go through our day and go through our lives. Well, if we're not replenishing those vitamins, we might feel great for 6 months, a year, maybe some cases with some of these, 2 years, a year, who knows, as your body uses that up. But you don't want to get to that point like you would with your magenta at home, and all of a sudden you have a report due and you need all this pink and you run out. And now you got to figure out how you're going to get down to the store to get your magenta cartridge, and it's just a headache, right? You don't want to do that with your body. As you begin to deplete those, you want to be sure you're filling them up with vitamins, because your body's having trouble absorbing it and getting it in there anyway. So we have to have a good regimen of vitamins to be sure that we stay healthy. So we all need to do what? Okay. The next common mineral deficiency is calcium. Calcium is a very common one. In fact, a lady over here was just talking about how she's calcium deficient right now, and she's got to add all this calcium to her diet. So a couple things to remember about calcium is there's different calcium out there, different forms of it. Two of the most common are calcium carbonate and calcium citrate. Okay? If you go to Costco, you see a big jar of calcium and it's really cheap. You're like,
bag is not good.
You'd be all, you look at it, look at the label. If it's calcium carbonate, it's probably the cheaper one. Okay, calcium carbonate is harder for your body to absorb. It has to be taken with food. You're not eating that much anyway, right? You're eating very little, so it's going to be difficult to eat your calcium at the same time you're taking you're eating. So calcium carbonate, and it also has a tendency to cause kidney stones. Not fun. Okay. Calcium citrate, on the other hand, is the recommended calcium for bariatric surgery patients. It's the easiest for your body to absorb. It doesn't need to be taken with food, and it doesn't cause kidney stones. So calcium citrate is recommended as the calcium that is for bariatric surgery patients. Okay, so be sure when you're looking at the labels you find the right kind of calcium. Why would you be deficient? Same thing. You bypass this area of your intestine where calcium's absorbed, or you're not getting that much in your diet because you're not eating very much. Again, the limited amount of gastric acid in your body, you're not able to break down the calcium. And the third thing to remember about calcium is you need vitamin D in order for your body to absorb calcium. They're telling you with your calcium, more vitamin D. Okay? Because if you're deficient in vitamin D or you don't get very much vitamin D, you're going to have trouble absorbing your calcium. So when you're looking for a calcium product, be sure it has vitamin D with it. All of our calcium has vitamin D. Okay, all of it does. Because of that reason, we want your body to absorb it. Okay, so it's very important that you remember that. Calcium D needs, vitamin needs calcium D for absorption. Some effects of a calcium deficiency could be bone loss, high blood pressure, even weight gain. If you're deficient in calcium, you could begin to gain weight. Have down here, Heather, our dietitian, put that on there. Heather's pick. It's a sleeping giant. Basically, calcium is that thing that a lot of people they put off, or it's hard sometimes to get all the calcium you need. Okay, a lot of doctors recommend about 1,500 milligrams a day. You know, some a little less, depending on what your doctor says, more or less a day. But it's hard to get that much calcium in your body. So, because you can only take about 500 milligrams in a serving. Your body can only absorb 500 at a time. So you take 500, wait a couple hours, sometimes 500 more, wait a few hours, 500 more. That's 3 times a day you got to remember to get calcium in your body. So it gets kind of put off sometimes, and it's hard to find sometimes calcium that you like. So you kind of put it on the back burner, and then people become deficient in calcium, okay? So we don't want that to happen, so we all need to do what?
Take vitamins.
I love you guys, you're great. Okay, so some other deficiencies with vitamins that are common. Some of your fat-soluble vitamins are common. A, D, E, and K are common deficiencies. Then over here, your water-soluble ones, a bunch of weird names. But the two I want to mention are cobalamin and thiamine. These couple your B vitamins, your B12 and your B1. Those are very common deficiencies for bariatric surgery patients. Okay? And I'll kind of explain why. Again, back to what we talked about. I don't have it on here right now, but as a bypass patient, you're bypassing that area where it's absorbed, gastric acid issues, but also up to 70% of patients, bypass patients, have low levels or deficiencies in vitamin B12 within the first year. It's very common, okay, a B12 deficiency. 30% experience deficiencies even with a multivitamin, especially an over-the-counter multi. Okay, so if you go to, Costco, wherever you go, and you get a over-the-counter multivitamin that's been formulated and created for the general public, most likely you're going to have a B12 deficiency. if you look at what's in that multivitamin, amount of B12, it's a very small amount, okay? And I think that's one of the reasons why it's a common deficiency, because a lot of people have surgery, they want to go buy an inexpensive vitamin that's not really made for them, but they go and take one a day or whatever they do, and they're not getting that much. And as a result, down the road, a year, 2 years down the road, boom, you're deficient in B12 or B1, okay? So it's very common. It's asymptomatic. Basically, it kind of gradually happens over time. This is the one that you might be fine for quite a while because you're only using this 2 micrograms a day, very little amount your body uses throughout the day. It's like that Cayenne Blue cartridge. You don't use it that often. It's very little, but it's being depleted if you're not getting more in there, little by little, okay? Symptoms can take up to 9 years to appear. You think you're fine, everything's great. I'm not taking my vitamins. I'm normal now. I'm okay. Now, I'm not saying you're abnormal, but my point is, when you have surgery, you've changed something. You bypassed a part. Your body's different now than the average person. You get a sleeve, man, they're cutting out a part of your stomach. They're making your stomach skinnier. Your body's different. So you have to remember that. Your body's different inside. So you need to think of things different when it comes to your vitamins. Yes?
Is it asymptomatic? So after 9 years or how many years, what are the symptoms that might begin to show up?
Well, some of the symptoms for B12. See, we're moving right along. There you go. Good question. You're tracking with me, man. Some symptoms and effects of a B1 and B2. All your B vitamins, these are common because they affect your central nervous system. Okay? So, for example, a B12 could be numbness or tingling of the arms and legs. Okay, that could be a symptom. Poor muscle coordination also can be something. Weakness, excessive fatigue, or vertigo. Neurological disorders, including things like disorientation, depression, irritability, memory loss, dementia. So when I look at that list, my wife reads that and goes, "That's you, Ken. You didn't put the trash out. You forgot. You're irritable." Now I'm just a man. Leave me alone, okay? So, or I look at this list and I think of my dad. He's 76 years old. This is very common for the elderly to have some of these symptoms. And you have to remember, you may be older, and that it may very well be you're getting older. That's why some of these things are happening. But you got to remember, your body's different, okay? And it might not be. It may be a B12 deficiency 6, 7, 8, 9 years down the road, okay? So don't just write off some of these symptoms and go, "Oh, I'm just getting old." Go get your blood work done. Get tested because you're different, just to make sure. We don't want to become deficient in these vitamins and minerals, because in extreme cases, you can have increased cardiovascular disease, heart problems, heart risk, and then in extreme cases, if not taken care of, paralysis can happen. People become paralyzed because they have a B12 deficiency. Okay, so you don't want to get to that point. I think some people have actually died as a result. And I don't want to use it as a scare tactic, so you take your vitamins, but hey, take your vitamins. So we all want to make sure you do that. You don't want to have these problems down the road. Okay, because you might feel great after surgery, everything's going good. And you're not taking your vitamins, you feel good, but you're going to have problems. Okay, so you don't want to become deficient in B12. So we all need to do what?
Take your vitamins.
All right. Okay, B1 is also very common. Thiamine is a B1, is your B1 vitamins, very common deficiency. Some symptoms of this are things like prickling hands and feet, a burning feet sensation, again, lack of muscle coordination or shaking, dizziness, disorientation, apathy, confusion, irritability. A lot of the same things that are listed with the B1, a B12. And then over here you have bariatric beriberi. It's like in extreme cases, it's a disease that you get as a result. Okay, this is when paralysis can kick in if you get to this point. And then the Wernicke-Korsakoff's disease is kind of a next level. You don't want to get there because that's where it's like extreme. So if you have a good vitamin regimen and you're taking, getting enough B12 in your multi, or if you're taking a secondary B12, however you decide to do it, shouldn't get to this point. Okay, but get your blood work done, and all you got to do is make sure you do what?
Take your vitamins.
And you're not going to forget that, are you? It all depends on what multivitamin you're taking. Okay? Now, when we get to our vitamins, we have a full B complex. All your B vitamins are in our multi. There's enough B12 in there's 500 micrograms, which is enough. You don't need to take anything else. You take ours twice a day, you've got enough B12. So if you take our multi, take it twice a day and add calcium. If you get our multi with iron, If you get our multi without iron, you add iron and calcium, and it's all there for you. If you're going to try to manage it yourself, that's fine, but make sure you know what you're getting. Make sure you know what's in that multivitamin, okay? Don't just assume because I'm taking a multi, there's enough A, there's enough D, there's enough B12, B1 in there, okay? Because it might not be made for you. A couple things to keep in mind with other common deficiencies. Your vitamin A is a common one for patients. Again, vitamin D is a common deficiency. Does anybody know the primary way we get vitamin D? Sunlight, right? So most of us are indoors all day working, especially out here where it's air conditioned. Okay, so we're in here all cool. Then we do go outside. What do?
Sunscreen.
Sunscreen. We block it all. Block that B12 because we don't want to get burned and get cancer. It's a little worse than having a B12 deficiency. I'm not sure. So, I mean, vitamin D. I'm sorry, vitamin D deficiency. So that's one of the primary ways. So you want to be sure you aren't deficient in D. Most people are. Patients and not patients are D deficient. A couple mineral and vitamin interactions to remember. Okay, a couple of these are very important. Calcium needs vitamin D for absorption. I mentioned that already. Just make sure your calcium has vitamin D with it. The second thing to remember is do not mix your iron and your calcium. Don't take them at the same time. Because the iron, and they have like this competition with each other, and what happens is when they come together, it flushes out the iron. You had a lady sitting in a support group saying, I'm deficient in iron, I'm deficient in iron. I take my multivitamin with iron in it and my calcium every morning. Well, there you go. You're taking them together. 2 hours, about 2 hours, spread them out, okay? So, so that way you have to know what's in your multivitamin, okay? Because you may have a multi with iron, you may not have them with iron. So you want to know that so you know when to take your calcium, okay? What makes Celebrate vitamins different? Well, a couple things, 3 things. One, we want to be an option for you. We're not going to come in and be arrogant and say, these are vitamins made specifically for bariatric patients. You have to buy these. You don't. There's a lot of other products out there, a lot of other companies. We want to be an option for you. We believe we've made it as simple as possible. And you need to remember, all the products we make, they are made for you. We don't sell to the general public. Okay, the amount of stuff for these products are for bariatric surgery patients. Okay, there's an organization called the ASMBS, and they come together and meet and say, these are the guidelines and recommendations that we want in the multivitamins and the calcium, how much bariatric surgery patients need. And all of our products are formulated based on that organization's recommendation. So they're made for you. ENS stands for Essential Nutrient System. Not a big deal, it's a great name. But what basically ENS is, we put together products where we want to be sure you're getting your calcium. So we have different ENS products. They all have 500 milligrams of calcium citrate in them. Some of them are your calcium citrate and a multivitamin mixed together, calcium citrate, multivitamin and protein mixed together, or a calcium citrate and protein together. Okay, so that's our ENS line, or ENS products. That's what it is. Anything that we can mix calcium with to help you get your calcium. It's one of the hardest things to get. Okay, ENS with protein, it's a 4-in-1 product. Okay, the 4 things it has whey protein isolate, 25 grams per serving. So you take 2 a day, that's 50 grams of protein. Okay, it has a full multivitamin. It's the same formulation as all of our other multivitamins. So when we get to, for example, somebody mentioned they love our mandarin orange. Okay, so this multivitamin is in your ENS with protein. Okay, you take 2 servings of this a day and 2 servings of these, same thing. Okay, so in 1 serving, you have your multivitamin, your 500 milligrams of calcium are in this, 25 grams of protein in this. So this is your multivitamin. It's not a meal replacement, a protein shake. It's your multivitamin with 500 milligrams of calcium a serving plus 25 grams of protein. So you put it all together. It's very simple. Take 2 a day, add some iron, or maybe a little more calcium depending on the recommendation. It's that simple, okay? Great product. We have 3 great flavors. We have orange cream, which is new. We also have vanilla cake batter and chocolate milk. So chocolate, vanilla, and orange cream. Okay, great product for early post-op. And one of the reasons why it's so good for early post-op is you're getting fluids for one. Dehydration is a huge issue early post-op. You have trouble keeping fluids down. You're getting your fluids when you take your vitamins and your protein all together. You're getting at least 8 ounces of water. Okay, so that's helpful. Also, it helps with nausea. How many of you guys felt sick after surgery when you take your vitamins, or some people didn't have that? Well, a lot of people do. They feel nausea after they take their vitamins. And a lot of times that's because of all the vitamins. When you chew it, your body's getting so quickly. This way you can sip it over a 15-20 minute time, and they get in your body a little bit slower as you absorb them. But we also offer some chewable multivitamins. They really recommend chewables early because your body's breaking it down as part of that digestive thing happening, and the absorption's happening quicker than taking a pill, if you can even swallow one. Okay, so it's already happening in your mouth. So it's really recommended chewables right after surgery, especially. Great tasting products of mandarin orange. My favorite's pineapple strawberry. And grape is, they all three taste really good. Vitamin A is a 50-50 blend, so toxicity isn't an issue. Vitamin D, we just upped our vitamin D to 3,000 IU of vitamin D in our multi. So you're getting more vitamin D. It used to be 1,000. So more vitamin D in your multi. B12, 500 micrograms of B12, and it's in the dry municipal, water municipal AD and K in there. Tastes great. All you have to add is calcium and iron if you took this multivitamin. Take 2 a day of this, and then add your calcium and your iron. And then we have our multivitamin. It's called our Multi-Complete. The complete stands for the fact that it has iron in it. So that could be an option for you, where you get your multivitamin and you get iron at the same time. 36 milligrams of iron. All the other ingredients are the same as the other multivitamin. All of our multivitamins have the same formulation. So if you take this multivitamin, all you have to do is add your calcium. It's all in there. All your B, all your D, 3,000 IU vitamin D, it's all in there for you. If you take this every day and you're compliant, I'm not going to guarantee, because there's always 1 or 2 people that could be a little different with their body makeup, but 98 to 99% of you will not be deficient in your in anything if you get this multi and you're taking your calcium correctly. Okay, it's that simple. We have calcium citrate. All of our calcium is calcium citrate. All of our calcium has vitamin D with it for absorption. That's what the plus stands for. This is calcium plus 500. All the plus means is there's vitamin D with it. Okay, 500 milligrams of calcium in our calcium plus 500. This is kind of the recommendation is 1,500 milligrams a day. So you take 3 chewables a day, spread them out over your time period, 2 hours difference. Great tasting products. We have berries and cream, cherry tart, and orange burst. Okay, so that's our calcium plus 500. Our iron, and I'm going to stand behind this, is the best tasting chewable iron on the market. Heads are nodding. If you've tried other different chewable irons, you try ours, everybody says your iron tastes the best, period. Okay, we have 18 milligram iron, is a tangerine flavor. Grape is 30 milligram, and berry is 60. Okay, depending on what you need, we have 3 different size levels, and they all taste great. Our brand new product is our ENS 2-in-1. Okay, again, back to the ENS products I mentioned. The ENS basically means there's 500 milligrams of calcium plus something else. So in our protein bar, we have 500 milligrams of calcium citrate in this protein bar with 15 grams of protein, along with 5 grams of fiber. So in 330 IU of vitamin D, so there's vitamin D with the calcium in there. They do taste very good. We have caramel chocolate crunch and peanut butter chocolate crunch. It's not a real big bar, it's kind of like a Rice Krispie treat with a little strip of chocolate on the back of it, and they do taste really good. So it's one way for you to get 500 milligrams of calcium when you're taking something else at the same time. Okay? So if you're looking for a way to get some protein along with some calcium, the new calcium ENS 2-in-1 bars might be something for you. And so we all need to do what?
Take your vitamins.
You guys are great. Okay.